Body sculpting has seen an enormous growth in the last number of years, and I think that it's fair to say that most consumers tend to gravitate to the latest and newest technology, and I don't think that anybody can open up a magazine, review any of the recent cosmetic surgical advances without seeing or hearing about laser-assisted liposuction. The most common names that come to bear are words like smart lipo, cool lipo, lipotherm, laser tight. These are all laser platforms for laser-assisted liposuction that really all vary simply by the wavelength of light that is delivered to the soft tissue, with one company feeling that their wavelength is more appropriate or does a more efficient job at fat melting or emulsification than the other. Whether in fact that's true or not, I still think remains to be debated. We've used a number of the laser platforms in this office and have settled upon the laser tight, which is a 980 nanometer wavelength laser. I think that some of the important things that being a smart consumer about laser-assisted liposuction is, what are the advantages of it? Is it an indication for every liposuction client? And I think that the consultation should bear out a number of different issues. Most importantly, laser tight and the laser-assisted liposuction platforms are, in my opinion, best utilized for small spot areas. I don't find much utility for the laser-assisted platforms in doing large volume liposuction, unless, of course, those individuals have had previous liposuction where the slightly excessive amount of scar tissue in the fat compartment makes traditional liposuction methods a little bit more difficult. So I think the respective advantage for the laser-assisted platforms are a great command of contouring ability for small spot areas, secondary liposuction, some of the areas that have traditionally been difficult with conventional liposuction cannulas, like the back, nape of the neck, posterior upper arms, and the tricep area. I think that there's a lot of utility for these laser-assisted platforms in these anatomical areas. I think that the other significant issue to be addressed is these laser platforms are not alternatives to traditional liposuction procedures. In our office and in most offices, this is an adjunct or an additional procedure that's used at the time of conventional liposuction. We don't make decisions about an individual having just laser-assisted liposuction platform versus traditional liposuction techniques. In this particular office, we use the laser-assisted platform to initiate the emulsification or fat melting process and then follow up with traditional cannulas for those larger volume areas. Decisions that need to be made on the part of the surgeon are whether to leave the emulsified fat products in the body to be slowly removed by the body, or whether we physically remove those contents at the completion of the case. And I think that we take that, at least in my office, I take that on a case-by-case basis, depending upon what I feel the patient's needs and desires are for their level of recovery. I think that the one clear advantage to the laser-assisted platforms is there's unquestionably less traumatic to the tissue, and I do believe that the length of recuperation is significantly shortened for the laser-assisted procedures.